Of course, you don't like Xan. I assume you mean Xanax. It actually helps people like me and people who have a script. Y'all doctors today are so annoying when it comes to helping people. I got this comment. I don't mean to pick on this guy. I got a lot of comments talking about, benzos really help me and my doctors are so stingy with it. And there's this kind of feeling that people have that like doctors are like gatekeeping the medications that work for some unknown reason. Now look, purely from a financial perspective, if I wanted to make the most money possible, I would give everyone Xanax or a medication like it to make them dependent on it, and then they have to follow up with me to get their script. They're motivated to come back. That would be a really awesome way to make more and more money easily, right? Like these people coming in, they're the best patients, they never no-show, they're always on time, and they love me because I give them exactly what they want. And I'm giving them the thing that actually helps. It sounds like a win-win-win scenario if there was not reality injected into that situation. And the reality is that long-term benzodiazepine use is 1, harmful to the brain, 2, counterproductive for treating anxiety. Sometimes people talk about like, I don't want to be on medication because I don't want it to be a band-aid. SSRIs and SNRIs are not really band-aids. They change your receptors in your brain, and they actually change more than just that in your brain to actually treat the underlying causes of anxiety. Whereas benzos don't. Benzos are literally just a band-aid, and you grow tolerant to them. And when you grow tolerant to them, you need higher and higher doses, and then their withdrawal can be deadly, can be fatal. With all that being said, I don't hate benzos. I prescribe them all the time. There is a certain use for them in clinical medicine. They're great for panic. They're great for very difficult time. And frankly, giving somebody a benzo and them just having it in their pocket when they're approaching a situation that they could get a panic attack or could be really stressed, that alone is therapeutic. Sometimes I give benzos just so somebody has the confidence to approach a stressful situation. So it's not about withholding. It's about making sure I'm doing the right thing for my patient. And I think a lot of doctors feel that same way, though I will say some doctors are probably a bit more biased and, totally scared to prescribe anything controlled. But that's just my personal view on it.